Hi everybody, Dr. Debunk, and this is part two of the little video update on my absence. Um, and as I mentioned at the end of the last video, the last thing I wanted to bring out, and this will be pretty short because I can only do these 30-minute clips, and I wasn't paying attention to time, is this new truth, the reality I see now of where mainstream medicine is going. Now, I've talked about this but the magnitude of what they're doing now. And so let's back up and help you understand. Medicine's about money. Medicine is about defining treatment protocols for diseased people. But somehow we become the authorities on human health. But doctors are licensed disease treaters and licensed drug pushers. And we don't take any classes on human health. But doctors are in charge now of guarding your health. You go see your doctor to get an annual physical or whatever else you go for. And the belief is that he is going to do the things that will keep you healthy for now and in the future. But that's not what we do at all. We're disease treaters. And so, and that's come from the major universities. And what's coming from the main universities, what has become standardized now, is this belief. And it's being taught in schools, whether they're saying it outright, I don't know. But here it is. You can't be healthy unless you go on drug therapies with age. And so now a 45-year-old male will come into my office, new patient, and he's on 4 meds. And I'm like, why are you on 4 meds? He's on a blood pressure pill, a diabetic pill, a cholesterol pill, because at 45, every American should be on cholesterol pills. Even your dog should be on it. And then maybe some kind of nerve modulating agent. And it's like those conditions, they're saying that, well, your blood pressure is borderline, you're almost high, so this will help you live longer. They give this one pill for blood pressure. They're called ACE inhibitors or ARBs. And they say, well, it's protective for your kidney. That's an oxymoron. Every drug taxes your liver and kidneys. Every drug. Every artificial drug made by man. And natural drugs can do it too. If you drink enough caffeine, it'll eat you. I mean, it probably take 60 years, whatever. But the point is, there's no such thing as a preventative drug. And so it's becoming standard procedure that, your hemoglobin A1C, which is this tool to measure your average blood sugars, it's getting close. Well, that's it. You need to go on a diabetic. Only they call it a pre-diabetic drug. But it's the same drug. It's a diabetic drug. And then, like I said, everyone in America, 45 and older, should be on cholesterol drugs. Why? Because drug companies like it. That's why. And anyway, and so it's being taught, it's being pushed. My colleagues, primary care medicine, it's just getting worse and worse, And it is impossible for you to stay healthy by taking more and more drugs. The drugs may delay the onset of disease, but see, here's the problem. If you have high blood pressure because you're a nervous wreck, the blood pressure pill may bring you in a normal range, but here's the problem. There's 5 other things, at least, that are being messed up by your body because you're a nervous wreck. So you got to fix your life and the nervousness, or you're 100 pounds overweight. That can cause. Well, that's strangling all your internal organs, and that's a circulatory problem, and that'll kill you dead. Just give it enough time. And so our drugs just mask what needs to really happen. And I've talked about this in the circulatory theory of aging, but it's really ingrained now, and it's starting to be standard of practice. And you're going to hear doctors more and more say that the science we have shows that you need to be on drugs or you won't live a long life. And nobody's even questioning, is that true? It's not even close. But it's like we see with everything, like I mentioned about the finances. It's like We're 37 trillion in debt. There's no answer for that. And so, no, and that's why they won't talk about it. They won't even talk about it. But how are my grandchildren supposed to pay all these taxes? $900 billion a year interest payment. And so, and it's important because it affects medicine. It affects, and so the only solution is stay healthy and have minimal contact with my kind. Regular doctors, not the ones like me who are teaching themselves human health principles. So it's important that you see where this is going. You must take more responsibility for your health. And to do that, you must make lifestyle modifications, which is what Debunk is all about. So if you haven't looked at the videos, slowly look at them all. Right now it's random. I got about 30 videos, but I will finish the other 5 theories of aging, which give you a whole picture of this, and you should watch them multiple times over a long period of time. Information can be used to change your life. And that's what this is all about. I want you to be optimally healthy. And you're going to need it because, like I said, I'm 70 and I love my job. It's great. But, retirement is really going to not be an option for a lot of people until much older. And even then, you'll have to find something to do. But the financial status of everybody is. Anyway, let's stay back on point. So that's a little update on these things. It really is exciting. I think I said it, but I want people who want these treatments to be done, natural treatments for cancer. And if this all comes to fruition, it's looking very good. With immunotherapies, and even without them, we may be able to cure certain cancers with all natural treatments. Except for ivermectin, which is a drug, but it's so safe, literally. And virtually you have no side effects at the doses that, like I'm giving for my 3 cancer patients, which are very high doses. Compared to what most doctors didn't get any experience. Wow, man, the bulk of what you could do with ivermectin. Because at the end of COVID, in the second year, when it was getting better, but we still had really sick people in the hospitals, a lot was given by the real top dogs, Corey and I don't know if McCullough treated very much. But anyway, that's it. I will crank out another video in a month, hopefully sooner, with updates and reminders and a bunch of new stuff. There's new stuff about sleep. I got a list, and I'll be doing it. So I'm Dr. Debunk. Thanks for watching.